Good evening, everyone, and welcome to our webinar introducing the Master of Science in Health Economics and Outcome Research, or MScHEOR, at the Swee Hock School of Public Health, the National University of Singapore. My name is Associate Professor Liao Qi-xiang, and I'm the Vice Dean of Education here at the school. It's my pleasure to be your host this evening. I want to thank you for taking your time to join us and for us to share more about this new program and how it can equip future leaders in health economics and outcome research. Our first speaker this evening is Associate Professor Alec Morton, who is the Program Director of the MSc in Health Economics and Outcome Research. Now, before joining the National University of Singapore, he worked with the World Health Organization and the Global Fund to fight AIDS, tuberculosis, and malaria, and has collaborated with the Ministries of Health in the UK, China, Singapore, and Thailand. He is also active in the International Society for Pharmacoeconomics and Outcomes Research and the International Health Economics Association. Prof. Morton will begin by introducing the health economics and outcome research and why it matters for healthcare systems today and how NUS is building capacity in this area. You also walk us through the vision, the design, and the opportunities of the MSc HEOR program. So, Prof. Morton, the floor is yours.
Okay, thanks very much, Qi-xiang, for that introduction, and thanks to everyone for joining us this evening. I hope you'll find this interesting and instructive hour of your time. So what I'm going to talk about is our master's program. So this is a new program in health economics and outcomes research here at NUS School of Public Health. I have really three topics that I wanted to cover in my talk. So I want to share a little bit about HEOR, Health Economics and Outcomes Research, as a discipline, as a field of scientific study, but also as a professional career. So to give you a little bit of a flavor of what's involved. To tell you about our track record in HEOR here at NUS, and also to share the design and concept of our master's program. So why we've introduced this program and how it's structured and how it will work and what you would experience if you chose to join us. So let me start with the overview of the discipline. So health economics and outcomes research is a young discipline. You can see on the right-hand side the webpage of ISPOR, which is the relevant professional society, the International Society for Pharmacoeconomics and Outcomes Research. You can see that ISPOR is celebrating 30 years. So this is a young profession, but it's also a very vibrant and fast-growing profession. What is it about? So health economics and outcomes research is an applied discipline that integrates economic evaluation and outcomes research to assess the value, real-world impact, and cost-effectiveness of health interventions. One of the reasons why this is so timely is because many health systems are struggling with an affordability problem. So costs go up year on year faster than governments and populations are able to pay. So the aim of health economics and outcomes research is to guide the efficient but also the equitable allocation of healthcare resources, taking into account the perspectives and demands of the various stakeholders in the health system. So patients, clinicians, payers, regulators, and also industry as the innovators, the inventors of new medical products. And this is a picture of where health technology assessment, which is one of the main applications of health economics and outcomes research, how health technology assessment fits within the health system. And you can see in this picture is HTA, health technology assessment, is right at the center of the health system. This is what makes it such an exciting field to work in, because, well, in HTA, you get to see over to the left, you get to see the science of healthcare, the development of exciting new products which can benefit patients. You also get to see on the right of the system, the healthcare system, to interface with the providers who deliver healthcare on the ground to the population and to patients who make people healthier. But you also connect up to government and policy making, and in particular, the financing side of healthcare. So the part of healthcare which supplies the money, which makes efficient care, effective care, and innovative care possible. Let me give you an example of how health economics and outcomes research, how prominent health economics and outcomes research is in the healthcare system today. So this is the CEO of Pfizer, Albert Bourla, speaking on CBS News. And he was talking, this is a talk in the context of COVID-19, but he was talking about the way that we price medicines. And he says, the way that we price medicines is we try to understand the value that they bring to society. So for medicines that prevent heart attacks, if you give it to 100 people and you have 5 less heart attacks, we price the medicine based on the value of this reduction in the number of heart attacks, the value of these 5 less heart attacks. So this, I would say, is the core idea of health economics and outcomes research. You can see there is the outcomes research part, so that is to do with establishing how many fewer heart attacks are attributable to a particular medication. And there's also the health economics part. So this is to do with valuing these heart attacks and translating this into a monetary value. And I think this quote illustrates how important health economics and outcomes research, how important HEOR is to pharmaceutical companies, to device companies, to medical technology companies of all sorts in today's marketplace. But HEOR is also a discipline which is used widely applied within the public sector. So many countries nowadays have health technology, HTA institutions, health technology assessment institutions, which use HEOR to assess the value of medicines, to determine whether medicines are cost effective, and to enable government purchasers, social insurers, to negotiate prices with industry. On the top left-hand side of the diagram, you see the Western Health Technology Assessment Agencies, NICE, Scottish Medicines Consortium, HAS in France, IQVIC in Germany, CADTH in Canada. And at the bottom right-hand side, you see the Asian HTA agencies, CNHDRC in China, NECA in Korea, ACE in Singapore, HTRG in Australia, HITAP in Thailand. And through the middle diagonal, you see the international organizations, ISPOR, IATA, UNETA, HTAI, and so on. So many countries now have some level of HTA capacity in their systems, and those which are lagging behind are very rapidly catching up and increasing in maturity. But don't just take my word for it. This is a report from an economic consultancy which forecasts the size of the HEOR services market over the next 10 years. So you can see, according to this report, the HEOR market is poised for rapid growth. And if you look at the red box at the bottom of the screen, you can see, well, Asia Pacific is observed to experience a notable rate of growth during the forecast period. So Asia Pacific is singled out as an area where particularly strong growth can be expected. So studying for an MSc in HEOR is one way to participate, if you like, in this growth, in the growth of this industry. So that's an overview of HEOR as a discipline and also as a profession. Let me take you through now HEOR at NUS and tell you a little bit about some of the things which we have been doing in this space and why we think now is a good time to launch a master's program. So to share, we have a HEOR Research Center. The name of the HEOR Research Center is HYPER. You can look online and find the HYPER website and find much more activity, much more information about what we do. But in a nutshell, I would say that HYPER does two broad things. Along the top of this diagram, you can see technical work that HYPER does. So evidence synthesis, looking out at the scientific literature and scientific evidence and trying to come to a judgment about whether a particular technology is effective or cost-effective. Health economic evaluation. So trying to understand using original data from within Singapore, trying to understand whether a particular technology, a particular medicine, a particular device is going to be cost-effective for our local population, and understanding how much it will cost the healthcare system, understand how much it will cost individuals as payers, understanding how much it will cost MScHEOR Life, and understanding how much it will cost the Singapore government through subsidy. We also do, moving along the top line, we also do modeling. So sometimes it's difficult to tell from the evidence of clinical trials what the long-term benefits of a particular new drug, for example, will be. So if you think about GLP-1s, these are obesity-controlled drugs, but they will reduce the number of cardiovascular incidents long-term. So modeling allows us to answer that sort of what-if question, where we extrapolate from the immediate trial outcomes to longer-term, more health-related outcomes, which matter more to patients. And you can also see at the far right, real-world evidence and data analytics. So this is a hot area in health economics in HEOR. This relates to using data from patient records and from other sorts of real-world sources, such as registries, to try to better understand how medicines are delivering value in real-world settings. So along the top, you can see the technical things that we do. Along the bottom, you can see the institutional and process things that we do. So we do work around priority setting and decision support, helping decision makers to balance different competing objectives, ethics and equity, helping decision makers to think about how they are going to protect the worst off, and capacity building. So we do training, particularly in low and middle income countries, to help develop the health systems in these particular settings. Let me also show a little bit about these regional capacity building events. So we've been working over the last 6 years, I would say, running events sometimes in Singapore and sometimes overseas on a range of different topics, which you can see down the left of the slide. We've hosted overall 33 events attended by participants from 40 countries and joined by government personnel from 22 countries. So we think of ourselves very much not just as a Singapore center, but as a regional center and as a resource base for the region. This is HTA Asia Link, which is one of the main networks which we are part of. So HTA Asia Link is Asia Pacific wide collaborative of HTA agencies and HTA researchers. You can see, if you scan the QR code, a recent report which Professor Lin from our school led on the use of real-world evidence to support drug reimbursement decision-making. And you can also see a picture of a recent event that we did with our friends at Beijing Children's Hospital. So this is a visit as part of a Belt and Road event back in 2024. What do we do within the local system? So recently we've been working quite a bit with PRECISE, the National Programme on Precision Medicine here in Singapore. We've been involved in 4 out of 5 of the clinical implementation pilots, which PRECISE has sponsored, on high cholesterol, on breast cancer screening, on kidney disease, and on drug response, so pharmacoeconomics, so using genetic testing within the clinical pathways for these different diseases. And the questions that we've been looking at include, is precision medicine, the use of genetic testing, is it cost effective in the Singapore context? How can we optimize precision medicine to make it to ensure that it's delivered in the most effective way, mining information that we have embedded within our patient records, optimizing the test microarrays to optimally suit the local patient population and the configuration of genetic disease which exists within the local population. How can we scale up precision medicine out of out of the implementation pilots to benefit the whole population, either for genetic high cholesterol or for pharmacoeconomics? And how can we reduce barriers to patients? So some of these barriers might take the form of reduced employability, so-called lost productivity associated with particular medical conditions. And some of these barriers may take the form of softer, more emotional concerns. So people may experience regret after genomic testing, because one of the consequences of genetic testing is that, well, you often have to have difficult, complex discussions with your family members, which may make people reluctant to undergo genetic testing in the first place, and may make people regretful about having elected to go for genetic testing after the fact. So we've been exploring these different sorts of barriers and how they can be addressed or reduced to ensure that everyone maximally benefits from this new technology. So that's given you, I hope, a little bit of a flavor of what our research group does. What I'll talk about now is our program. So this is, if you like, the main purpose, I guess, of this webinar. So we're just launching this MSc in HEOR, but this is not our first sally into teaching HEOR or HTA. In fact, for a number of years, we've had a master's in public health, which had a health technology assessment specialization. So what we've done is to take the learning that we have from that program and build from that a freestanding master's in health economics and outcomes research. So this is in response to feedback from our stakeholders, both in the public sector and also in the private sector, who've been telling us that there is a strong demand for employees with health economics and outcomes research with HEOR skills, and that they would rather have someone who has a specialized master's rather than have someone with a master's in public health, which has HTA as a special topic. So what we see that there is a growing demand within the region for this particular specialization, and we see there's an expectation that people will have a specialized master's, which reflects the complexity and the profile of this particular discipline and this particular specialization. We also see the HEOR intake as being a slightly different intake from a traditional MPH student. So we see MSc HEOR students maybe as coming from a healthcare background, but possibly coming from a broader quantitative background. So maybe that could be economics, maybe that could be statistics, maybe that could be a science subject. They may have a healthcare experience and a healthcare background and wish to develop their technical skills, or alternatively, they may have a technical background and wish to develop their healthcare sector knowledge and expertise. And the sorts of employers that we see for this program fall under three headings. So some graduates may wish to join the public sector. They may wish to join HTA agencies, ministries of health, ministries of finance, hospitals, academic health clusters. They may wish to join the private sector, so pharmaceutical companies, device companies, in market access, government affairs roles. They may wish to go into specialized consultancy. So in many markets, there is a rich network of specialized consultancy companies which supply services to help the large corporates negotiate the barriers to access for their products. Or they may wish to go into voluntary welfare organizations or third sector organizations which have an interest in health economics as part of the evaluation of their work. But they may also want to go into, our graduates may also want to go into academia. So they may want to go into universities and research institutes. So we try to provide students with the skills and training, which will enable them to go on to move into a research career if that is their objective. In terms of the structure of the program, we have two options. So there is a 12-month program for full-time students. There is a 24-month program for part-time students. So we anticipate that some students may wish to study part-time because they have full-time jobs. In order to graduate, you have to complete 6 core courses and 4 elective courses and to fulfill our GPA requirements. In terms of the program delivery, we offer our courses as a mixture of in-person and online. We think the in-person element is important so that students can get to know each other and get to know their teachers. But we also recognize that while online has advantages, particularly for students who have busy lives, some of our classes we will conduct as intensive in-person sessions. So full day classes or maybe 1 week classes. This enables us to bring in, for example, international faculty, so particular teachers who have specializations that we wish to draw on and involve as part of the program. And we're also building a stackable pathway. So it should be possible to build up from a graduate certificate to a graduate diploma to a full master's program in a series of graduated steps. And we'll be sharing the details of that stackable pathway on our website sometime soon. To give you a little bit more of an idea of what's inside, these are the core courses. So for full-time students, the core courses will be delivered in semester 1, and the elective courses will be delivered in semester 2 with a capstone running throughout both semesters. For part-time students, the structure will be a little bit different. So there will be 2 core courses in the first semester of year 1, followed by 2 elective courses in semester 2 of year 1, followed by 2 more core courses in semester 1 of year 2, and then the 2 final elective courses in semester 2 of year 2 with the capstone project running through the course of year 2. And we've got a number of elective courses, so this is a list which changes depending on teacher availability, but you can see some of the courses that we've got in play at the moment. There's also, here's also some information about program fees. You can see if you're a Singaporean or a Singaporean PR, you are eligible for a discount. And if you're an NUS alum, you are also eligible for a discount. And just to conclude, here's a list of the selling points of our program. So you can see what we feel that we're offering is a specialized master's, which is tailored specifically to Asian contexts. So much of our teaching is based on experiences within the region and based on knowledge and involving teachers from across the region. We think that we have a career-driven curriculum with real-world impact. We feel that we have a lot of knowledge of HEOR and HTA, not just from books and theory, but also from working with decision makers in Singapore and in the region. We are, I believe, according to QS rankings, ranked number 1 in Asia. NUS is ranked number 1 in Asia and number 8 globally. So we don't chase the rankings, but still it's nice to be recognized. Our teaching team, we think, blends academic excellence and practical experience. So this is one of the reasons that we want to run this program. We feel that we have a lot of knowledge which we have built up over the last few years, which we would like to share. And we try to provide a flexible and work-friendly learning structure so that if you are working full-time as you're studying with us, we make it as easy as possible for you to participate in our program without compromising your performance on the job. and you can scan the QR code if you want to find out more. But I think that's all from me. So I will hand over to our administrative colleagues who will share some of the details of how to apply with you. So if I may stop sharing my screen.
Thank you very much, Prof. Morton, for that very comprehensive overview of both the discipline of HEOR and also the master's program. Next, we'll hear from Mr. Theo Mulder, who is our program's administrative lead. He will explain the practical details of the MSc in HEOR, including the admissions requirements and the applications process. So, Mulder, over to you.
All right, thank you, Prof. Liao. And thank you, Prof. Morton, for the insights to the program. I trust that everyone should be very eager to know how to get into the program now. So let's dive into the program's admissions requirement and the application process slide. We welcome all applicants holding a bachelor's degree in healthcare or quantitative related disciplines, and you will need a good honors degree or equivalent to apply. And if you do not possess a good honors degree, don't worry, we will still consider your application if you have 2 years of relevant working experience. Next, if your degree is not from a Singapore Autonomous University or an English medium institution from Australia, Canada, Ireland, New Zealand, United Kingdom, or the United States of America, then you will also need to submit the TOEFL or IELTS test scores. You will need to attain a minimum of 85 for the TOEFL internet-based test or 6.0 for the IELTS academic test. Moving on to the application process, you can actually scan the QR code on this slide to get to the How to Apply webpage quickly. On this webpage, you can find the application overview guide that gives you an overview of the application process and the key documents that you will need to prepare before your application. You can also find the application user guide that gives you a step-by-step guide to the application portal. Once you're ready, you can click on the Apply via NUS portal button to submit your application. So these are the documents that you'll be submitting. You can find a list in the application overview guide as well. Just a few points to note. If you have not graduated from the program, you can upload the most recent transcript for our review. For Singaporeans, please upload a valid NRIC, especially if you have renewed your NRIC at age 30. And for internationals, please upload a valid copy of your passport's biodata page. Next would be the proof of financial support. If you're self-financing, you can upload the latest payslip or bank statement. And if you are sponsored or under a scholarship, do upload the official award letter. If your parents or guardians are sponsoring your studies, do upload their latest bank statement or payslip and a sponsorship letter. You also need to nominate 2 academic or professional referees to support your application, and they should be using their official organizational email addresses. And lastly, you will need to request for your official transcripts to be sent to us directly from your university. And this can be in the form of a link where we can download your official transcript, or an electronic repository, or a file from an authorized staff of the Academics Records Office. These should come from an official university email that we can verify from your university's website. You can also engage credential evaluation services such as WES, World Education Services, Parchment, or CSSD if your degree is from China. When you're ready to apply, you can head over to the application portal to find our program by checking Masters by Coursework for the degree type. And make sure you select the correct academic load here, because this determines if you're applying for a full-time or part-time program later on. Next, select the intake you're applying, then click on View Programs. You can then follow through the steps in the application user guide to complete the main application. There are 3 parts in total. After completing the main application, you will need to complete a supplemental application form that contains additional program-specific questions before paying the application fee. Okay. And finally, if you wish to be considered for financial aids, you can indicate yes to questions 2 and 3 in the supplemental application form. Right. Thank you. Back to you, Prof. Liao.
Thank you, Moda, for laying out the application process so clearly. We'll now move on to our question and answer session. So I'm going to give you a few minutes. Please type in your questions into the Zoom Q&A box, and we'll do our best to cover as many as we can. And I'm seeing some questions coming in already. So as you're typing in, we'll probably take the first few questions here. Okay, the first question here is, how will the workload be like for part-time students? Is it advisable to take this course on a part-time basis while holding a full-time job? Can I maybe direct the question to Prof. Morton?
Yeah, so I think whether it's advisable to take the course on a part-time basis while holding a full-time job depends on you and depends on your level of commitment to some extent. So we do see this as being a program which will be of interest to people who are in work particularly. We've tried to make it as work-friendly as possible. So in terms of scheduling, we've got a mixture of evening classes, of intensive classes. So you're not expected to come in to the university every day during office hours, as might be the case if you were doing a traditional undergraduate program, for example. So it should be possible to arrange attendance at the teaching sessions around the demands of your job. But I would say studying part-time while holding a full-time job is always challenging. It is a rigorous and demanding program. So if you do decide to take it while you're studying full-time, you should be prepared to, while you're working full-time, you should be prepared to work hard, and you should be prepared to burn some of your evenings and your weekends doing the assignment. I mean, I hope that's not too off-putting, but I want to give people a realistic sense of the demands of the program.
Thanks, Prof. Morton. If I may add, when this program was first designed as well, the intent is to make sure that those who are actually working could also could actually read it, including those who are actually international. So it's actually being crafted in a very, very specific way to actually give you the opportunity. But as Prof. Morton said, it is a bit of hard work, but I think it's not impossible. Okay, I'm going to go to the next question. The next question is on scholarships. I think this question is going to go to Prof. Morton as well. So are there any scholarships available? I believe many people will want to know the answer to this. Prof. Morton?
Yeah, so we are exploring scholarships. So as you know, Chi-Sen, on the MPH, we have a good record of getting scholarships. But this is a new program, so we're having new discussions with new partners. If you want to be considered for a scholarship, as Moda said, please indicate that on the form when you fill it in.
Okay. Here's a long question. I'm just going to read it. Okay. It says here, I read from your website about the funding and sponsorship documentation requirements. I would like to ask for clarification. Does it mean that if we have not yet secured funding or a scholarship for this program, we cannot submit the application? In many cases, especially with government scholarships, applicants are required to first obtain a letter of acceptance before they can be awarded the scholarship. Is there any guidance or procedure for this situation? This question can be directed to either, I think, both Prof. Morton and Moda.
Yes, I think I'll take this question. So if you have not secured a scholarship, you can actually submit your application and state that you are self-funded for now. And after which, after you have obtained your letter of acceptance and the scholarship, you can update the school that you're under a scholarship, and we will update accordingly.
Yeah, I hope that answered the question. Just a reminder for the participants, please put your questions in the Q&A box. There's a Q&A section because we're also seeing questions coming from the chat box as well. It's a bit difficult to navigate, but we'll try to capture all the questions. Yeah, I'm going to go to the next question. And this is a question for Prof. Morton. Could you kindly share an overview of what the capstone project would look like?
Oh, so the capstone project will be an applied research project where you have the opportunity to bring together the things that you've learned in the other parts of the program in order to do a real life, to do a study relevant to HEOR, during which you will be mentored by a member of academic staff. So this could be a cost effectiveness analysis, or it could be another form of research. So for example, one of the pharma partners that we're working with is interested in understanding some methodological issues around the calculation of productivity losses. So that is to say, the economic losses from someone being taken out of employment by ill health. So we've been talking to them about sponsoring a project on that topic. So that's a for example. But I'd expect that the capstone projects will be, will be quite diverse. There's a number of different forms that a capstone project could take, depending on the students' interest and also on the opportunities that we have available within the school.
Thanks for that. Okay, there's a question from a potential full-time student, working student. So the question is, can we do part of it and awarded a certificate? I think this is in reference to the stacking model that you showed earlier. So again, the question can go to Prof. Morton or Moda.
So the answer is yes, and I believe we're working out the details for that arrangement now.
Okay. And let me go on. Let's have a look at this question. Okay. There's a question here on the date line, I think. After application closes in November 2024, when can we expect admissions acceptance? When I think is when the acceptance will be notified. Maybe from Moda.
Yep. So we aim to let the applicants know of their outcome sometime in late March or early April.
Okay, it's great. Okay. Here's another question here. How many full days of commitment are required per semester for part-time students? Maybe to Prof. Morton.
Yeah, so maybe we can answer this one with the questioner directly, because there is a number, but I don't immediately have the number on top of my head. So it might be easier if we can send the information through later.
Okay, that's great. Okay, I've got a question here about switching modes. The question here is it possible to switch from part-time to full-time or vice versa midway through the program? This question for Moda.
I think it'd be quite tricky because it's a short program of 2 years for part-time, and students are supposed to complete their capstone if you're full-time in the first year, which is the only 1 year, and for part-time you'll be completing your capstone in the second year. So we wouldn't actually advise students to switch. Yeah.
So we would, I'm sure, endeavour to accommodate people who have complicating circumstances. But I agree with Moda. It's not because if you were studying full time, then you would start on all of the core courses in semester one. Once you got halfway through semester one, you'd already have started a lot of the courses, so it would be a bit difficult, logistically speaking, to switch.
Okay. I think we have answered most of the questions. I hope I did not miss any questions, but I want to thank you all for your questions. And again, a big thank you to Prof. Alec Morton and Mr. Theo Mulder for their presentations. Now, we hope this session has given you a clearer picture of what the MSc HEOR is about and how it can support your career journey. If you'd like more information, please visit our website and reach out to our program office. Now, on behalf of the Swee Hock School of Public Health, we want to thank you again for joining us, and we look forward to welcoming you, some of you, to our MSc HEOR cohort. Have a great evening.